Hi, my name's Sarah. I'm from the International Committee of the Red Cross. Healthcare is one of the most important services that we need to survive in the world today. Unfortunately, it's also one of the first casualties of war. Healthcare depends on a relationship of trust between the healthcare practitioner and the patient themselves. It's this trust and the access to healthcare that breaks down in conflict. This is through direct attacks on both healthcare workers and patients, facilities they use, ambulances, and those who drive ambulances. It also, however, is affected by insecurity, general insecurity. If violence continues for a long time, then essential medicines may not be able to get to clinics. Doctors and nurses may themselves not be able to travel to a hospital or a facility, or may seek to flee with their families if they are themselves in danger outside of their work. In addition, if there is a front line between a family or a patient or a child or a mother who needs to give birth and the hospital or the place of help that they need to get to, they may simply not be able to travel there. Healthcare, however, is protected in war. It's protected by international humanitarian law or the law of armed conflict. This law states that healthcare should be provided by anyone conducting an armed conflict, any party to a conflict, and that this should be protected and ensured that it is as a vital service it's available for populations in need. It is this breakdown between reality and the law which the ICRC is seeking to address in its project Healthcare in Danger. This project was launched in August 2011 and will continue until November this year. It has sought to raise awareness of this problem, which we consider to be one of the most underestimated humanitarian problems in the world. Unfortunately, we see it every day on our newspapers, on our televisions, and in the news more generally. The fact that people are unable to get treatment for what they are essentially need to have that treatment to live. So this project raises awareness of this problem. We also then have sought with people around the world in lots of different sectors to see what can be done to try to solve the problem. Sometimes healthcare is deliberately withdrawn, and that is clearly illegal. However, sometimes it's also, healthcare itself is collateral damage. It is affected by prevailing insecurity, which is not necessarily a deliberate strategy. It may be, but it's not necessarily. So that means, in a way, we think there are enough people out there that can try to make a difference to change the situation through adapting their policies. This can be both healthcare personnel themselves, ensuring that there are safe places to take patients when fighting starts around them. Also, the arms carriers and the weapons bearers, the armed forces, the armed groups who are perpetrating the violence also can implement policies to ensure that what they do has a minimal effect on patients and doctors, such as when their armed forces feel the need to conduct a search of a hospital. This is done within strict constraints and does not affect the running of a hospital unduly. Also, just simple adherence to the existing law is really essential, and the law that says that hospitals, for example, cannot be targets of violence. They cannot be deliberately used as places to store weapons, because this affects those who genuinely need treatment within that facility. So alongside raising awareness and trying to develop these solutions, the ICRC is supporting everyone who tries to help those patients who need support, who need to be able to access healthcare, both healthcare as in connection with violence, such as for treatment of shrapnel wounds or having as a result of having been shot or unduly affected by armed violence, as well as routine patients who perhaps need kidney dialysis or need treatment for diabetes or need a midwife unit to give birth. This is something that we're trying to do around the world and is of extreme importance.